Knee problems outnumber all other kinds of exercise injuries. It's a wonder our knees last as long as they do. In general, there are two types of knee injuries. One happens all of a sudden, putting you out of commission right away. Often these are the worst of all, but there really isn't much you can do to prevent them. There's one kind of knee injury that can be prevented, the kind that sneaks up on you gradually with any repetitive activity such as running, tennis, or aerobic dancing. One day you notice a little pain in your knee after a workout. It's in the front where it hurts, but you can't put a finger on just where. A few days later you notice that it's hurting toward the end of your workout, and pretty soon it's there all the time. Pretty soon it'll be hard for you to sit for any length of time with your knees bent. You become one of those people who's always stretching out their legs in the aisle of a theater or in an airplane. After that, your knee may begin to swell. That causes the knee to ache, usually in the back where most of the fluid accumulates. When you bend your knee, it may feel as though there's an orange in the back.
Here's how to look for swelling in the knee. Stretch both legs in front of you on the floor without tightening the legs and check to see if both knees look the same. There should be hollows on both sides of the kneecap. If the hollows on one leg are less obvious than the one on the other, or if they're not there at all, it means your knee is swollen.
Now it's time to do something about it. If you don't, chances are the swelling will get worse, and then all sorts of problems are going to start up. For example, a swollen knee can change the way you walk, which can affect the alignment of your hip, which can even lead to back problems. The problem goes by the name of chondromalacia. It's usually caused by changes in your routine, and it's all the fault of your kneecap. When the knee moves, the kneecap slides up and down along a groove in the thigh bone, almost as though it were on a little track. The problem is that sometimes the kneecap gets out of alignment. It doesn't have to be off by much to cause a lot of trouble. The way your body keeps this from happening is by relying on a tiny section of the lower part of the thigh's quadriceps muscle called the vastus medialis. It's located here, just above and to the inside of the kneecap. Its job is to tug at the kneecap and keep it in line. Unfortunately, this little muscle is the first to get weak when you're out of shape or injured, and the last to get strong when you're starting to exercise again. And if it's too weak to handle your workouts, chondromalacia is the result. You can do a lot to prevent and treat chondromalacia, and it's easier than you might think. Just strengthen the vastus medialis.
Here's how to do it. Do it with Larry and me. Straighten out your leg in front of you like this and relax. And now place your fingers right here above your kneecap and a little toward the inside of your leg. And now tighten that muscle like this. If you're doing it right, you should feel the small muscle below your fingers get tight, really tight. That's the one. That's the vastus medialis muscle. Sometimes it's hard to tighten this muscle. You may find when you tighten your thigh, all the other muscles in the area get tight and the one beneath your fingers remains soft. In that case, you have to learn how to control the muscle. One easy way is to roll up a towel and place it beneath your knee. Then press the back of your knee down into the towel. Feel the vastus medialis tightening under your finger? You can do the same thing by putting your fist beneath your knee and pressing down against your fist. Continue doing the exercise in this way until you're able to tighten the vastus medialis muscle without anything underneath your knee. The idea is to tighten up and hold it for a count of 6, relax for a couple of seconds, contract and hold it for a count of 6, and relax for a couple of seconds. Do 4 of these contractions 10 to 15 times a day. Oh, it may sound horrible, but it's really only 7 minutes of work every day. And it's easy to fit into your schedule if you tie it to something you already do. For instance, if you're in school, do the contractions every time the bell rings. If you're in an office, do it every time the phone rings. Or if you're at home watching TV, do it at a station break. Don't do it when the ads are on, though, or you'll get a muscle as big as a house. Don't try to do 50 of these at a time. Just a few will do. You'll be able to see the increase in the muscle in just 2 or 3 weeks. And the odds are that if your knee is hurting, it'll start to feel better. By strengthening this muscle, you may never have to suffer this problem again.
Sometimes the kneecap has been pulled so badly out of alignment that it even hurts to do the tightening exercises. If so, you can push your kneecap to the center of your knee and then try the exercises. Some people like to wrap their knee with an elastic bandage or wear a neoprene sleeve. You can buy these sleeves at most sporting goods stores. They keep the knee warm and may help hold the kneecap in place. Giving yourself an ice massage after working out helps hold down the swelling. Aspirin or other anti-inflammatory drugs like Advil can help as well. But nothing will get rid of the problem or keep it from happening in the first place except making the bad legs stronger.
So remember, to prevent and treat chondromalacia, strengthen the vastus medialis muscle.